Suppose this is the patient and this is the head of the patient. These are the legs of the patient, and legs are facing towards you, head is facing away from you, and we are cutting the slices like in this way, and we will interpret. So the very first slide would the markings has been done, and we will just identify the structures there. So let's start. So the very first structure, this one, and this structure too. Both of these structures, they are actually lungs. So definitely the patient is the legs are facing you and head is away from you, and you are cutting the slices. So the one will be right lung, and two will be the left lung, and this structure exactly which I am marking now, this is the aorta of the patient. Okay, and structure 4 and structure 3, they are the chambers of the heart. Actually they are ventricles, and 4, it's definitely left ventricle, and structure 3, it's right ventricle. Okay, and what's that structure 5? It's the vena cava. Okay, and finally, what is this structure? This is basically rib, and these radio opaque, these are all ribs of the patient. And finally the structure 9, the dome of the diaphragm, or you can say that liver is now emerging. Now we will move on to the next number 1 slide. And structure number 2, they are the lungs. Structure number 8, which I am marking here, this is the vertebral body. 7, this is the aorta, and you might be thinking, what is this hollow structure filled with air? Basically this structure exactly I am showing. This is the esophagus. Again structure 4 and structure 3, they are the ventricles. Definitely 4 will be the left ventricle, 3 will be the right ventricle, and structure 5, again this is IVC like in the previous diagram, and 10, this is liver. Okay, and these structures definitely they are ribs. Exactly I have marked with figure 9. Well, now we have moved to the next slide. Again you are seeing many one here, 1 1 1. So all of these, they are definitely lung, and again like in the previous diagram, this structure is a vertebral body. Okay, and this structure, this is the new structure you are seeing in this diagram, and this structure is definitely a spleen, and again this structure is new in this diagram, and I am marking this structure. So and this structure number 3, this is actually a stomach. So we have given the patient the oral contrast, so it has whitened that area. Again what is structure number 4? This is hollow tube, which is known as the, definitely it's esophagus, and there is gastroesophageal junction, and this area is the cardia of the cardia of the stomach. And what is this structure 9? Actually this structure, this is IVC. As you are seeing, these 3 veins, they are entering into the vena cava. That's the 10, 11 and 12. So the 10, actually it's the so it's on the right, definitely it's on the left side. So this is the left hepatic vein, this is in the middle, so this is the middle hepatic vein, and the structure number 12 definitely it will be the right hepatic vein, and the structure 8, it's the liver. So we have marked this area, and again the structure number 7, they are ribs. So now we will move towards the next slide. Again, I have missed this structure. This structure you will not definitely forget the structure. This is the aorta of the patient. Hope you have understood something. Moving towards the next section of the CT scan. Again, structure number 1. This is actually lung. Okay. Now the structure 2. This is the liver. Okay. Structure number 10. This structure. This is a spleen. Now the structure number 10. This structure. This is stomach. And this a hollow tube. Structure number 11. Basically this is the splenic flexure. Okay, and structure number 8, exactly this structure. This is the aorta of the patient. Structure number 12, exactly this structure. I am going to mark this. This is crura. And this structure number 6, this is IVC. And what's that structure number 4? This is the portal vein. And what is this structure which is dividing the liver into two parts? This is actually falciform ligament. Okay, and this structure number 7, this is a part of, or you can say that this is a branch of the portal vein. And these structures, again, these are ribs. Hope you have understood some of the basic structures. You have identified the basic structures. Structure number 2, this is the segment 3 of the liver. Okay, and now the structure number 4, exactly this area is of the pancreas, and 4 is body of the pancreas, and 5, this is the tail of the pancreas. Okay, and this structure number 9, this is actually splenic vein. Okay, and structure number 8, structure number 7, this is aorta. Okay, and you might be thinking, what is this structure number 10? Actually this is the celiac axis. Okay, structure number 6, this is IVC, and this structure, exactly this structure, I am structure number 3, this is the portal vein. Okay, and finally we are left with this structure number 11 and 12. Actually this site matters a lot. Exactly this site. This is the site of the adrenal glands, and normally adrenal glands, they are not visualized, but if the adrenal tumors are there, so you will search at this spot. So hope this slide is being complete. This is again this large structure, this is the spleen. So there is no logic to identify this. Already I have mentioned it, and these are Definitely ribs, again no need to mention. This is the vertebral more body. Complicated for you. One is definitely liver. Okay. Now the structure number 12, which I am marking now, I think no need to mention this structure. This is spleen. Okay. The real game starts here. The structure number 5, this is pancreas. Okay. This structure number, sorry, this structure number 11, exactly this structure is splenic vein. Okay. Now the structure number 9, this is the aorta. Okay. And here you are seeing the celiac trunk, structure number 7, and here it is giving the splenic artery. Okay. And on this side, this is giving the common hepatic artery. Okay. And structure number 6, this is IVC. Okay. And structure number 4, this is the portal vein. And now here, this is the right branch of the portal vein. Here you are seeing the shadow, exactly black area. This is the gallbladder bed. Okay. And this is the vertebral body. These are ribs. So I don't think it's necessary to mention all these things. The most complicated things you have marked and you have understood. So let's move to the next section, more complicated one. Structure number 9 and structure number 10. They are crura, and exactly this point, this is an area of the uncinate process. Okay. Structure number 5, these are the loops of the bowel, basically small bowel loops are there. They are shown as whitish areas because contrast, we have given the oral contrast in this patient. Structure number 6, this is the splenic vein. Structure number 7, this is the splenic artery. So remember one thing for the life, when the both vessels are together, then the vessel with the larger diameter will be the vein, and the vessel with the smaller diameter will be the artery, and at the end this structure is spleen itself. Okay. And finally, this is area of the portal vein as a continuation of the superior superior mesenteric vein. Okay. Next section, again structure 1. This is liver, and here you are seeing the hypodense area in the segment 6 of the liver, and this is the aorta of the patient. And now this structure number 5, exactly this structure, and this structure is the superior mesenteric artery. Okay. And structure 2, they are the loops of the bowel, the small bowel, And structure number 3, it's important, it's IVC. And the structure number 8, exactly which I am marking now, this is the splenic vein. And structure number 9, this is spleen itself. One thing I was missing, exactly this point, this is the superior mesenteric vein. Okay, now while moving towards the next slide, next section of the CT scan, the structure number 1, it's very simple, it's liver. Okay, and structure number 2, this is the hollow viscous, so it might be the gut loop. Okay, and exactly this area is of the transverse colon, and all this structure, this is actually greater omentum. And structure number 8, they are the loops of the gut again. Structure number 4, this is one vessel. Structure number 6, this is another vessel. Structure number 4, definitely it will be the vein, so it's the superior mesenteric vein. Structure number 6, this is the superior mesenteric artery. So in the previous section I have told you that the vessel with the greater diameter will be vein, and with a smaller diameter will be the artery if they are present together. So structure number 7, this is aorta. And structure number 5, this is IVC, and a vessel is rising from the IVC, it's the left renal vein. And here you are seeing the new structures 12 and 11. Actually we have moved downwards, so now they are the poles of the kidney. Definitely on the right side it will be the right kidney, on the left side will be the left kidney. And structure number 9, it's the spleen, so no need to take stress. Moving towards the next section, so moving towards again the next slide, structure number 1, it's the liver. And structure number 3, this is the kidney, definitely it's on the right side, so it will be the right kidney. Structure number 4, it is the left kidney, and this is spleen. Okay, this is the vertebral body. Okay, and structure number 8, it's the IVC, and from the IVC the structure number 11, it's arising, it's basically left renal vein going towards the left kidney. And structure number 6, this is the aorta. Okay, and from the aorta structure number 7 is arising, and this is the left renal artery. Okay, and structure number 9 and structure number 10, structure number 9 is superior mesenteric vein, structure number 10 is superior mesenteric artery. Okay, and this is the transverse colon, structure number 5. Well, now I am moving towards the next section of the CT scan. Structure number 1, this is the rectus muscle. Okay, structure number 2 and 3, they are the internal oblique transversus abdominis, and external oblique, they are muscles. And structure number 4, this is the colon. And structure number 5, this is the right kidney. Structure number 7, this is the left kidney. Okay, structure number 12, this is the vertebra. And here the important thing is structure number 8, exactly this is the aorta. And structure number 10, this is the right renal artery. Structure number 11, this is the IVC, and from the IVC right renal vein is arising. And Definitely this is the kidney, this is kidney. And now moving towards the next section, you are seeing these are the muscles. One, rectus muscle. These are the internal oblique, external oblique, and then transversus muscles are there. And 6 and 9, definitely they are kidneys. And all other they are the bowel loops. And structure number 11, this is the aorta. And structure number 12, this is the IVC. And here, what's that structure? Actually, this is the psoas muscle. Now moving towards the next section of the CT scan, and you might be thinking where the aorta has gone. Definitely aorta has bifurcated now, and the structure number 8, this structure, this is the iliac crest. And structure number 10, this structure is the gluteus muscle. And this structure number 7, this is the iliopsoas muscle. And structure number 9, this is the iliac vessel, this is also iliac vessel. And structure number 4, these are the gut loop. So one, the rectus muscle is ending here, and two, the oblique muscles and are they are continuing there. But the structure number 4 and 5, one of them, one structure is there, one structure is there. One is artery, other is vein. The 4 is artery, so this is the external iliac artery. 5, external iliac vein. So you will see the rule is same. Having the larger diameter will be the vein, having the smaller diameter will be the artery. 6, 8 and 9, they are the gluteal muscles, but I don't know the names, so sorry for that. And what is structure number 3? Actually structure number 3, it's the bladder. Okay. And what's the structure number 11? This is rectum. Now I'm moving towards the next section of the CT scan. So first of all, I will identify this structure. This is the pubis symphysis. And structure number 1. Now the bladder has ended and a rounded structure is there, which is shown by 1, and this is the prostate. Okay. And just below this hollow area, this shown in black, this is the rectum. And structure number 8, exactly this structure, this is the obturatus internus muscle. And structure number 9, this is the head of the femur, and this is the neck of the femur. And this area, this is the acetabulum actually. And structure number 3 and structure number 4, they are the blood vessels. One is artery, iliac artery, and another is the iliac vein. And structure number 6 and structure number 7, they are the muscles. Definitely gracilis and other muscle, and I am forgetting the name of, sorry for that. Last section of the CT scan of the pelvis, and here you can identify some of the structures. 7, 8 and 9, they are the muscles. Structure number 2 is the obturatus internus muscle. And structure number 11, this is the ischial tuberosity. And structure number 10, this is the shaft of the femur. And with this, there is end of the pelvis. So Dr. Emglani is signing. Do subscribe our channel by clicking on the red button below, and don't forget to press the bell icon also.